Westminster Free Clinic and Community Center is a not-for-profit healthcare provider in Ventura County. It includes people of all faiths and ethnicities and is run by healthcare professionals including doctors, nurses, nutritionists, dentists, and over 80 local high school volunteers. Let's take a look at the clinic and its unique approach to preventative health care for the working poor and uninsured.
We're really a community care center for many different services. So our first piece is primary care, but then in addition to primary care, we have health supporting services, which includes anything from nutrition to exercise to empowerment to health literacy, pathways to self-reliance. So we're actually helping with training programs, paraprofessional training programs for our patients, for our students, for others that help people learn to be self-reliant and not need our clinic anymore.
It's holistic. It doesn't just do the medical care. They've got chiropractic, they've got podiatrists, they've got pediatricians, they've got nutritionists, they've got exercise counselors, they've got social counselors, they've got school counselors for the kids, they've got everything under the sun. They take care of everything. They'll even help people do their taxes at the end of the year.
By offering preventative care to our community members, there's less stress on our emergency rooms and everyone just enjoys better health. So it's really a fantastic organization that impacts our entire community.
By providing them with a partner in their health, we partner to preserve health. We are here to help them help themselves.
One such program that is paying big dividends is the Diabetes Clinic.
So the Diabetic Clinic started about 4.5 years ago when a few of us who were involved with the clinic for a long time really saw the need for patients who have chronic illness such as diabetes. They need to be seen more regularly. We thought, gosh, if we could give them appointments and have a little diabetic clinic, we could do some teaching that was special for diabetics only. Dr. Elman and myself kind of created this diabetic clinic.
Today, we just saw a patient that made a tremendous improvement.
She lost 20 pounds in 3 months. Her A1's, she's like not even a diabetic right now.
Almost, yeah, not a diabetic anymore.
And she came in 3 months ago. She had a wonderful doctor who motivated her. I think she's in part of the Leaders of Change program. She's availing herself of all the wonderful opportunities at the clinic, and she's right there. and we are so proud. We are so proud of her.
Another very successful program is the Corazones Sanos and Leaders of Change.
Corazones Sanos is like the big umbrella, and then underneath the Corazones Sanos, there's more programs, more activities. Some coordinating the weight loss program, which is Leaders of Change. Also, we have under Corazones Sanos, we have the hiking program, we have the Zumba, we have the yoga. We have also even the 21-day challenge where they can go outside and walk for 21 days and come back and lose weight. I participated last December and I lost 10 pounds. It's just like getting good habits and eat the right portions and eat right.
So behind me is our fresh fruit and vegetable program. Everything's bagged up now, ready to give out to the patients. A couple years ago, we realized we were giving patients advice about how they should live their lives to improve their health, particularly the diabetics and the people with hypertension. We told them they had to eat a plant-based diet and they had to get more fresh fruits and vegetables in their diet. And then we realized our patients can't afford fresh fruits and vegetables. We all know how expensive they are. So we looked around the community and we found an organization in Oxnard called Food Share. So we work with them now to provide as many of those as we can every Wednesday free to our patients.
What we expect is more knowledge about nutrition, and also their behavior is going to change, and it's been changing lately because they are more aware, what's going on in their own body.
I've even had patients to tell me that it not only affects them, but their family members as well, because they want to not only take care of themselves, but the rest of their family members.
They know that they're not alone in what they do, as well as when we go to outreaches and we see patients who perhaps have high blood pressure but they don't know it. We help them be aware of their situation and find ways that they can fix it and live healthier lives.
Corazones Sanos is supported by the students in Salud.
Salud stands for Student Advocates Leading Uplifting Decisions. I like Salud because they go to local markets and they help the patients a lot more in clinic because they have a dot system where the red dots mean it's good for the heart, like cardiovascular diseases, and then the green dot that has a D on it means that it's good for diabetes. We have those dots so our patients can know what they can eat and what's healthier for them. they have an option to eat healthier foods.
It also helps markets gain more business. At the end, we would offer them a card, and every purchase they make that involves one of the marked foods, we'll give them a stamp, and when they fill a certain amount of stamps, they will get a discount or a prize. Now, let's take a look at the heart of the clinic, the volunteers.
We started out very small over 20 years ago, and we've gradually grown to include high school students, adults, physicians in the community, and dozens of other people that have come forward to help us.
The centerpiece of the clinic's volunteerism is the student internship program.
Our teen training and internship program is especially unique. There are just a few in the whole state of California that focus on high school students.
At Westminster Free Clinic, you get a unique experience that you can't find anyplace else. It's definitely not candy striping. This is a place where we treat you as our colleagues. We realize you're high school students, but we treat you as medical professionals. You're part of the team. We depend upon you doing your job and doing it well. You'll learn more than you ever thought you could. You'll have close working relationships with doctors, nurses, pharmacists, chiropractors, psychologists. You'll be able to really see what medicine is and what it isn't.
Let's take a look at the typical night for the student volunteer.
We come here at 4:30 and nothing's set up. It's like an big empty room.
We set up first, get all the chairs out.
Yeah, then once setup's done, all the patients are assigned like a number. We receive a patient and get their name on a little piece of paper. Then we call them out and then ask them a basic history, a medical history, and why they came to the clinic.
From there, we take them and we present them to the nurses who fill out kind of a similar form that we filled out. Pretty soon after, we get told that we can go to the doctors, and we kind of shadow the doctor and present to the doctor what the patient's complaints are.
I was totally expecting just to be like an observer and just watch the doctors treat the patients, but it's really cool how we get to have this hands-on part in treating the patients.
In regards to the student program here, the patients are actually a part of the teaching program. This clinic is not just a one-way clinic where we provide services for our patients. We get as much as we give from our patients.
So it's been quite a learning experience, I think, for both sides, in more ways than just medicine.
The intergenerational approach to working with medical practitioners as a high schooler has definitely opened my eyes to the capability of the younger generations in these days. It's very eye-opening to see how much young people can do. And I think that the fact that there are working professionals that can appreciate this aspect and even integrate it into their own lives in volunteering, it speaks a lot to both generations.
Because when you know that you affected someone else's life in a positive way, it really touches your heart.
When you give young people responsibility, they react by becoming very responsible.
And we have alumni scattered and now are working throughout the United States.
8 years ago, we met Dr. Ellman and his daughter, Elizabeth.
She went on to UC San Diego, and so she did her undergrad there. She's finishing up med school now after taking a year to get her master's in public health at Harvard, and now she has half a year left of med school. And I think the clinic was instrumental in helping her shape her goals. 10 years ago, my daughter, Elizabeth, dragged me along, and so I came here to see what it was about, and I haven't left. It speaks to me.
Not every student at Westminster Free Clinic ends up a doctor, but 100% end up going to college.
One of my duties here at the clinic is to help students with math as a math tutor. I'm a retired math teacher from Thousand Oaks High School, and I've noticed that many students have trouble with math here, but can't afford to have a tutor. A professional tutor or teacher would cost them $40 to $60 an hour. One of the skills that our students need in order to get into a good college and to be able to stay into college is to have good math skills. So that's one of my objectives here at the clinic.
My focus is on the low-income and first-generation volunteer interns, although I work with every student who is here. I work with them on planning for college, making sure they're taking courses that will get them to college. I help them with applications, how to write your personal statements for your college application, and then financial aid, which is a big part of it.
The best part is the people involved, especially the students, but all the other volunteers and stuff involved. It inspires me to see what all the different people are doing from all kinds of different walks of life. I especially like it when I see patients that used to be patients here that then come back and volunteer. I think that just just a really cool aspect of it.
I've been coming to the clinic about 10 years, and when I started coming, my A1C was 8.7, and the last test I have was 6.8. For that reason, I think the clinic will help me big time. So I try to give you something back, and I do printing from them. I do banners, I do flyers, I do newsletters, and anything they need, I do for them.
There's a lady who told me about this place, and since that time, I'm here, and I'm so happy to be here. I can help others, and that's the most important thing for me, to help others. I have a very good relationship with the patients, with the students, with everybody, so that's what I like to be here. But the most important thing is to help others. That I'll be here forever. Well, if I'm still alive in 20, 30 years, I'll be here for sure, yeah.
The Westminster Free Clinic is doing great things, but it needs your help and support.
We definitely need more medical volunteers, specifically physicians, nurse practitioners, pharmacists, nurses, and other types of medical professionals who can help us serve the community. We have way more patients than we have practitioners. The other way they can help is if they are a professional who can have patients come to their practice in their offices. For example, an optometrist, if we could send a patient to them for glasses or for eye exams, or if we can send someone to a dermatologist to check on whether they might have skin cancer. Another way people can help us is by donating. We definitely are a locally funded organization which relies on individual donors and service clubs, the faith community, and foundations to fund the work that we do. So the money that people give goes directly back to helping the patients and the volunteers. We get the medical supplies, we're able to pay for the labs or the medications that the doctor's prescribing, so the doctor feels like they're not wasting their time, they actually can follow through with their plan of care.
I think for anybody who has heard about the clinic, I really invite them to come here and take a tour. You really need to come and see clinic in action to really understand how many things go on at once and how many people are being reached at the clinic.
And I've been blessed in my life, and I feel I will want to do something to give back to the community, and this is my own way of extending gratitude and service to people that need, my expertise.
I personally started volunteering here because I wanted to help others, and I have learned to just absolutely love it. It's a great place to be, and the patients are so grateful.
I thank God for this clinic, and I think God will help find a way to help this clinic.
I'm a volunteer here, so I think you receive more given to others, and I love it. You fell in love and help others for your heart. So just try once.
My song is love unknown, and I've got to get that message home.
Westminster Free Clinic is doing great things, but it still needs your help and donations to continue the great work that is so badly needed in our communities. Please contact us for information on how to donate or volunteer.